Hi there. Today I want to talk about what we do when you come in for your initial appointment. We always want to talk about your symptoms and what you're feeling, and that's super important, but it's also really important to do objective tests so that we can test as a baseline to know where you are at when you come in, and then after your first phase of care, be able to retest. One of the examples is just a simple range of motion test for your low back. But instead of just doing a range of motion and just seeing how it feels, we actually measure the distance and we record that. So then after the first phase, we're able to see the difference. A lot of times people's symptoms will be improved, but maybe not completely improved. But we see such a huge change in the objective tests and range of motion, we know that we're on the right track. One of the other tests that we do in our initial assessment is bilateral weight scales. It's important that we hold our body even side to side. You can imagine if you're constantly leaning on one side, you're going to potentially wear that side out faster with some early degeneration. You might get the opposite side of muscle compensation and soreness, and we want to be able to have things as balanced as possible. As much as people always think it's hip related, it can also be shoulder related. So for example, if I'm leaning over onto this side is likely going to be heavier, and then as it starts to come back, it's going to start to balance out. So this again is another one of those great baseline tests where we test before we do our first phase of care, and then after the first phase of care, we're able to retest to see those objective changes, because it's really important to understand that your body is healing from within. Another one of the initial tests that we do is balance. Balance is so important, especially as we age. Balance can be one of the #1 reasons that people have falls in their older years and get injured. So balance relates to what's going on with the lower limbs, but also what's going on with your brain-body connection and the posture and how your neck and spine is connecting. So we are going to test your balance with your eyes open first for about 30 seconds. If you're okay to do that, like one with your eyes open, we take that to the next level and do that same test with your eyes closed. Because when you close your eyes are just a cheating mechanism. You're able to look on the wall and be able to try to find something to focus your gaze on, and it makes it a little bit easier. When we take that away, you really have to work on that brain-body connection. And so this is a really great way for us to test and again see the changes from the initial phase of care to another test that we do has to do with that brain-body connection again, as well as balance side to side. It's a really great test to be able to understand, do you have a tendency from one side to the other? Do you have a dominance? And do you know where your body is in space? So you're going to bring your hands up and you're doing a stomping test. We're trying to stay in the same spot. Now, when we do it, we also have your eyes closed because, again, we really want to test how that brain-body connection is happening. Sometimes people will move forward, sometimes they'll turn to the side, sometimes they won't even finish the full 30 seconds because they really have no awareness of where their body is. When we are finished our first phase of care, most of the time we see a significant improvement. Some of this also has to do with posture. So, for example, if your posture is like this, your brain's going to think your body's here and you're naturally going to fall forward. Versus if you're in a nice upright posture position, you're going to be able to know where you are in space accurately. Another test we do is posture. We want to test your posture pre and post that first phase of care, as well as into second, third, fourth phases of care, depending on what your goals are. A lot of times we will see things like the shoulders coming back, the head into a good position. You want to make sure your ear is right over your shoulder. You want to make sure that you're not leaning forward. So that's another change that we see where this is a nice straight line, as well as sometimes we'll even see twisting to the sides that's able to be nice and aligned. Posture is the window to health. It's very important. And you know that when we stand up straight, we look good, we feel good, our bodies are functioning at a higher level. Something else we do in our initial appointment is check your feet. Feet are your base of support. They're very important for your foot, but not only that, your ankle, your knee, your hips, and how the whole body is functioning. For example, let's say you have one foot that's really flat and it's going to roll in. That's going to put pressure on your knee, on your hip. That's going to put an issue side to side to create imbalances. And if we can give you a good arch support to help minimize that collapsing, you're going to be in a much better position with less pain and less early degeneration in those joints. So we always want to make sure that we are assessing our patients for any foot issues that we can help with. Symptoms are so important and we want them to be getting better, and they do, but sometimes your objective tests will get better first, or sometimes your symptoms will get better first. And it's important for both of them to get better so you can be as optimal as possible.